Week 9 of pregnancy is a time on ultrasound where it really starts looking like a baby in there. You can see the head and you can see the torso. You can see arms and legs, and the arms and legs are even moving around. The baby's actually starting to develop fingers and toes, although you won't be able to see that yet on ultrasound. But it's really starting to look like a cute little baby. You can see it jumping around in there, and it moves around as you're watching on ultrasound. Now, way too early to actually feel it move around, but on ultrasound, you can certainly see it. The heartbeat's nice and strong on ultrasound. For most women, you can't quite hear it yet with the office Doppler. In very thin women, if the baby happens to be up high, you might be able to just hear the heartbeat yet, but in most cases, you can't hear the heartbeat with the little office Doppler instrument. But you will certainly be able to see and hear it on the ultrasound. The baby has grown to 1 inch in length, so it continues to grow rapidly, and all the parts are developing now, and it's developing very quickly and rapidly at this point. Your HCG levels are starting to peak, but they're up there pretty high now in the tens of thousands of range, and that can cause a lot of discomforts like nausea, vomiting, fatigue. People complain of pregnancy brain, where they start forgetting things, and that's a very common finding. Now, some women skate through the first trimester without any of these symptoms, which is great. Don't be worried if you don't have them. But for some women at this point, the nausea can be pretty debilitating and the vomiting can be pretty awful. Don't be afraid to use a prescription that your doctor might give you for the nausea and vomiting, as that can help quite a bit and is perfectly safe for the baby. There are several different options that your doctor might write for you, but believe me, he's not going to write anything that's not perfectly safe for you to take. At this point, you've already had your first prenatal visit, you've had your labs drawn. If there was any problems on there, the doctor's office would have called you, so no news is good news, but they're testing you for lots of different things like anemia, to see what your blood type is, see if you're Rh negative, and also for various infections. Also to see if your immunizations that you got as a child are still functioning. So those are all things that have probably already been tested for, and you should have gotten a phone call by now if there was something that really needed to be dealt with right away. The other thing that we look for in the first trimester is something called bacteriuria. It's basically a urine infection, but not quite. It's bacteria in the urine, which if you weren't pregnant, we probably wouldn't treat. But in pregnancy, we do like to give you antibiotics for that, because if we don't, we know there's about a 25% chance that you can end up with a kidney infection sometime during your pregnancy, and those are miserable. So you may get a call from your doctor's office suggesting that you take antibiotics for a urine infection, which you might find strange because you don't have any symptoms of urinary infection. But that's the reason if you do get that phone call. So week 9, you've got what really looks like a baby moving around, arms and legs moving, the fingers are starting to form. It's about 1 inch in size now, and those symptoms of pregnancy are kind of starting to peak.
Medtwice.com